All right. Okay. Good evening, everyone. I see that people are starting to join us here. If you want to just put in the chat box that you can, just confirming that you can hear us, because that's a big part. Awesome. I like when I hear loud and clear. Perfect. Can hear you. And can people see the 3 cameras that are currently on? That's not an issue for anybody? Perfect. Okay. Okay, perfect. So just going to go through here. Just give me one moment and we'll get started in just a moment. Okay, hi Doug. That's good to know. Yeah, so the issue with using a phone, and I honestly haven't used an iPad with this, so I'm not 100% sure on that. The issue with using a phone is that you won't be able to use your mic or your camera. So with the iPad, is it saying that it's the browser that it's not supporting, or is it the whole fact that you have an iPad? Because sometimes I know with me, I need to use Firefox for mine versus Chrome. Okay, so what I'm going to do is, I know we're having a few technical issues for a few people, and I understand that. So I'll kind of deal with that on the other side as some people get started. Okay. So what we'll do is, currently there's supposed to be another moderator with us. I'm just having difficulty finding them on the list right now. So hopefully they'll be able to join us shortly. So I'll get started just doing a bit of an introduction here, so that we can kind of get a move on, since we're already a little past 5 here. Okay. So I would like to welcome you to the Movember Symposium. So it's essentially all about men's health promotion. So I do appreciate that you're taking the time to join us tonight. I know it's in the evening, so for those of you who kind of were looking forward to having the evening off, I do appreciate you taking the time to come here. Okay, so this Movember Symposium is being presented by both Health Promotion. So I'm from Health Promotion. My name is Lisa. I'm the Health Promotion Specialist, and also the 4-Wing Defense Women's Advisory Organization. So you may have heard from either our champion, who's Major Alexia Hannum, our military co-chair, who is Corporal Emily Ryman, and then myself, I'm also the civilian co-chair of the DWAO. So we've all been kind of pushing this. So awesome. That's essentially who it's being put on by. I do need to go over just a few little things before we get started on the content. So one thing to note is that this is being recorded for viewing for later purposes. So just heads up on that one. We do want you to definitely be engaged, but feel free to just kind of be present and listen to the speakers if you're not comfortable using the chat box or speaking up or anything, just due to the recording. I will also let you know that people's stories are theirs alone to tell, and that includes the stories of our presenters. So we don't want you to be kind of going off of this, out of this recording and kind of telling everyone else your version of people's stories, because that's not really appropriate. I will also say that although this is going to be generally pretty good, it does come with the fact that there is some content may not be appropriate for younger viewers. So if you do have any children around you, which may be the case if you're joining us from home, just keep that in mind, that we are going to be talking about both men's physical, mental, and social well-being. So there may be a topic in there that just may not be appropriate for younger viewers. So just, if that's the case, I'm going to leave it to you as the parent or the guardian for your discretion. Okay. All right. I'm just going to double check to see if I can see that list again. God, I love when technology just doesn't like it too much. Okay, so what I'm going to do is I'm going to introduce our first speaker. So essentially how this is going to work is we do have 4 speakers here. One of our speakers is having some technical issues, so I'm hoping we can figure that out. If not, we'll see how we do with that one, okay? But our 4 speakers we have Dr. Joelle Thorgrimson. Did I say that correctly? Perfect. Okay. So she's going to be our first speaker here. So I'll introduce her first. So Dr. Thorgrimson is a 4-wing Indigenous flight surgeon from Kenora, Ontario. So she holds astrophysics degree from Queen's University, as well as a Master Science in Quantum Physics from McGill University. And she's completed medical school and family medicine residency at Northern Ontario School of Medicine. She also enjoys flying adventures as a private pilot. So that's fantastic, being where we are located right now. I do know that we have a bunch of people joining us from kind of all over. So maybe some people also from close to where you're originally from. So that's awesome. I'm going to turn it over to you. What I'm going to ask is that Sergeant Jordan, I'll just get you to turn off your camera. I'm going to turn off my camera so we can hand it over to Dr. Thorgrimson for her time. You'll have about 15 minutes to just kind of explain about men's physical health, and then we'll have that 5-minute question period for anybody who has some questions about that. Okay?
Sounds good.
All right, I'll turn it over to you.
Thanks, Lisa. Just a quick thanks to the DWAO for inviting me to speak, and also an acknowledgement of the DWAO's accomplishment of getting a nursing room on the 4-wing base this fall. Really happy about that advancement, so thanks everyone. My name is Joelle Thorgrimson, flight surgeon here in Cold Lake from Kenora, Ontario, and it'd be wonderful if someone else here is from Northern Ontario. I'm Indigenous, and I think it's important in this time of reconciliation to acknowledge the land that we're on is the traditional territory of the Dene, Cree, Nakota, Sioux, Saulteaux, and Métis people. So I was asked to speak about men's health and what does anyone do when they're asked to speak about a topic. I Googled men's health, and then of course the magazine popped up, and all I saw was abs galore. But all jokes aside, being a man can mean a lot of different things. And to be inclusive and also to celebrate Trans Month, which is in November, I thought we'd talk briefly just about sex versus gender, and then we'll go into some topics that I think are related to men's health. So in terms of like sex versus gender, sex is more of the biological attributes that you're born with at birth. So those are internal and external genitalia, your hormones, your genes, and also secondary sex characteristics. So maybe your hair distribution, your fat distribution, and voice frequency. And then gender is more of your cultural or psychosocial role, and that's not actually apparent at birth. So this can include things like how you identify. So you can identify as a man, woman, maybe queer, non-binary, fluid, your gender expression, which might be the clothes that you're wearing, your hairstyle, or your makeup. And then your role, so your societal expectations, including communication style and I don't know how you can present at religious ceremonies. So it's important to keep in mind that although today I'm going to be talking about things related to men's sex, I don't want to exclude anyone in any way who identifies as a man. So just wanted to put that in there. So just starting off with a quick story about a 55-year-old male from rural Alberta who works on the oil patch, hunts, fishes, and has gained a few pounds throughout his life. He drinks socially, as we say, and doesn't remember the last time he saw a doctor. So this hypothetical person or patient is a lot of the men that I see in my practice, and also pretty much identical to most men in my family. And eventually, something significant happens and brings them to the doctor or the hospital. And so today, we're only going to be talking about a few things related to men's health, but I just want to let people know that if you're experiencing any symptoms, please reach out and don't wait, and don't brag about not seeing your doctor. So for the few topics that we will touch on in the next 15 minutes, I'm going to talk about some things that men worry a lot about, symptoms that most men will eventually experience in their life, and finally, trying to lead a healthy lifestyle to minimize the probability of those things happening. So I'd like to start with cancer screening. One of the big ones that a lot of, I guess, people think about when we talk about cancer screening is testicular cancer. It's actually only about 1% of the cancers in men are this type, but they are important because, especially in the military population, they generally present in men between 15 and age 35. So if you're young and you feel something that you don't think is normal down there, come and see us for sure. But the more common cancer is prostate cancer, and it's actually the second most common in men outside of non-melanoma skin cancer. So very, very common. Risk factors for this include aging. You can't do anything about that. Having a relative who has had prostate cancer also puts you at higher risk, and if you're of African and Canadian descent. Interestingly, the guidelines have changed relatively recently, and typically, like in the past, you would go in and get blood work and get a physical exam. Now we have more of a conversation about if it's worth doing that blood work, because a lot of the time we get abnormal results and that leads to more testing. And 7 out of 10 people who have prostate cancer actually won't die from it. So they're relatively slow growing. Some can be relatively slow growing, others can spread faster, but we always have that conversation about benefit versus risk. The eventual treatment would be surgery and radiation, and all of these things have risks, so you can get erectile dysfunction or incontinence from both of those. So have that conversation with your doctor about if the screening is right for you. But I just thought it'd be important to mention that because it might be different from 10 years ago when you saw your doctor. Moving on to some symptoms that we generally, like most men, are going to experience sometime in their life, and those symptoms are related to being able to pee. So we call them lower urinary tract symptoms. We separate them into different groups. So one is in the bladder, like where the urine is stored, actually peeing, and then after you pee. So some of the symptoms of storage might be you have to pee more often than normal. You have to go right away, such as urgency. You have to get up at night. And then some of the voiding symptoms. So when you actually have to pee, it might burn when you pee. You might have to really push hard. It might be hard to completely empty your bladder. And then you might have dribbling during that. And then after you pee, you can have a sensation of not being completely done or dribbling then too. There's a ton of different reasons why you can have these symptoms. One can be prostate cancer. Others can be a urinary tract infection, sexually transmitted diseases, medications, kidney stones, lots of things. But it's important for us to figure out why that's happening. One of the more common causes of these symptoms is something called BPH, or benign prostatic hyperplasia. And so that just means that you're having these symptoms, but your prostate is growing. And 50% of people who are age 50 will have this, and 80% of people who are age 80 will have this. So chances are that you might If you're male, you might have this in your lifetime. Usually for testing, when you go in and see your doctor, you'll get blood and urine samples taken, and then from there we can go on to changing how you're living your life, so not drinking as much fluid before bed, avoiding certain medications that might irritate it, and then from there we have medications and eventually surgery. Other things that are quite common in men, and I'm not sure if people are comfortable with their children hearing about this, but I thought it'd be important to talk about erectile dysfunction. There's different causes, and when you go in and bring this up, we'll probably ask you about all those. So one is that the blood vessels might not be functioning properly, and those could be from high cholesterol, diabetes, high blood pressure, maybe previous surgery. Other things can be the nerves aren't working properly. So diabetes and surgery can cause that, but also things like multiple sclerosis. Hormones, you might have low testosterone, your thyroid might not be functioning. And then there's also might have anatomical variations. Medications such as antidepressants can sometimes cause this, and other things like psychological diagnoses like depression, anxiety, and substance abuse. Interestingly, cigarettes and alcohol make erectile dysfunction worse, and also cannabis users have 2 times a higher rate of erectile dysfunction than people who aren't using cannabis at all. And then just moving on to, I guess, healthy lifestyle and what are things that we can do to prevent some of those things from happening. As I mentioned, avoiding smoking, alcohol, any type of recreational drug like cannabis, doing aerobic exercise, and the current guidelines is 150 minutes a week. Controlling your blood pressure, controlling your weight, having a healthy diet, getting your flu shot, and also right now in the time of COVID, wearing your mask, staying 2 meters apart, washing your hands. The whole country is increasing with cases right now, and we're also having this happen in Cold Lake. So I'd really, I guess, from 22 Health Services, we'd really appreciate it if you followed all those for everyone's sake on the wing. But those are the main points I wanted to chat about today. Thanks for inviting me to speak, and please follow up if you are concerned about any symptoms that I mentioned or any other things related to men's health. And I just want to acknowledge 22 Health Services, the clinic that I work at in Cold Lake. They've been doing a ton of work during this pandemic, and they really deserve appreciation for all the efforts that they're doing. So thank you to my team, our team, and I'm happy to take any questions if anyone has any.
Thank you for that presentation. If anybody does have any questions, feel free to type them out. If you do want your mic on to ask a question, just ask for your mic in the chat box and I can individually ask for some people. So we'll wait just a couple of seconds here and let people have a chance. If you can't think of a question right now, you'll also have time at the end of the entire presentation when all of our presenters are done. Presented, great job, awesome. No questions? Okay, so we'll move on. We do have our moderator who has joined us after a few technical issues there. So again, I want to thank you, Dr. Thorgrimson, for presenting. We greatly appreciate you taking the time. If you want to hang out for the rest of the presentation, and then if there's any additional questions at the end, we can kind of do a full roundtable then. So I'll just get you to turn off your camera and mic there. Perfect. And I'll get Mike, who is our moderator, to turn on his camera and mic. If you could do it, hopefully it works. Awesome. Great. Okay, so what I'm going to do is I'm actually going to switch it over. I'm really the technical person on that, the kind of hidden side. So I'm going to switch it over to Mike now. Mike, if you could introduce yourself, just let us kind of know why Movember and International Men's Day is kind of important and why we're here, because I missed that part at the beginning. And then if you want to introduce our next two speakers, that would be awesome. Oh, and your mic's off. Can't hear you. Technology does not like us tonight. Indicates your mic is on. Okay, can anyone else hear him when he says something? Just wondering if it's just me, because my computer's been known to have issues. No? Okay. Let me just check on my end. Is your mic turned all the way up? Ah. Okay. Apparently I'm staying as the MC right now. I could also pass it over to Emily. So Emily's also on here. Okay, so I have to enable your mic through settings in the application. Monica's given a bit of advice here. Using the built-in mic. Okay, so what we'll do is we will continue on. Hopefully Mike can figure out his mic issues. So if you want to turn off your camera, I'll let you just kind of try to figure out your mic issues on the end. Emily, do you mind just coming in and kind of swoop it in for Mike there for me? Sweet. Okay. Make sure your mic's on too.
Yeah, it's on. Can you hear me good?
All right, I'm going and hiding again.
Okay, so just a little bit of a background here. Tomorrow is actually International Men's Day. Yes, there is a day for men. On November the 19th is International Men's Day, and that's celebrating worldwide the positive value that men bring to the world, their families and communities. International Men's Day highlights their positive role models and raises awareness of men's well-being. So in theme with that, we also have Movember right now, which is the leading charity changing the face of men's health. Movember fundraises for awareness on mental health, suicide prevention, prostate, and testicular cancer. Since 2003, Movember has funded more than 1,250 men's health projects across the world, challenging the status quo and shaking up men's health research and transforming the way health services reach and support men. So as the DWAO, we thought that it was important to highlight Movember and also International Men's Day to really bring them into the fight for gender equality. Another important piece about Movember is that the men's health is in crisis. Men are dying on average 6 years earlier than women, and for largely preventable reasons. Unchecked, prostate cancer rates will double over the next 15 years. Globally, testicular cancer is the most common cancer among men aged 15 to 39 years of age. And across the world, 1 man dies by suicide every minute of every day, with males accounting for 75% of all suicides. Movember is uniquely placed to address this crisis on a global scale. Movember funds groundbreaking projects all over the world engaging men where they are to understand what works best and accelerate change. So thank you to all the guest speakers today. This is incredible that we're able to put on this symposium. And I will now present the next two speakers that we have. The first is Sergeant William Jordan. Sergeant Jordan joined the Army in 1999 as an infantryman. He was posted to 3 PPCLI and deployed to Bosnia on Operation Palladium from February to August 2000, in Afghanistan for Operation Apollo from February to May 2002. He remustered to AVN in 2005 and was posted to 410 Squadron in 2006, and then to 409 Squadron in 2012. In 2015, he deployed to Kuwait on Operation Impact with 401 Squadron. After completing a year-long second language training in 2017, he was posted back to 410 Squadron and placed in charge of 410 Phase Line from December 17th until January 2020, where he was transferred to his current job as the 410 Squadron Chief Warrant Officer Assistant. He and his wife, Andrea, have 2 boys, Dylan and Isaac. I'll also introduce Doug Brown as well. Doug is a retired member of the Canadian Army, having served 24 and a half years with the Royal Canadian Regiment. For the past 14 plus years, he has been supporting our ill and injured members of the CAF at the Transition Group. New to Cold Lake this past APS, Doug has taken on a new role with the TG Transition Group called a Transition Advisor. The role of the TA is to help members and their families make an informed decision and to have resources available to them to help facilitate a positive transition from the CAF to civilian life. So with that, over to you two.
Sergeant Jordan and Doug Brown, you can both put on your mics and your cameras. Sergeant Jordan will just talk first. So Doug, if you wanted to wait, you can, and then we'll switch out, okay?
Can everyone hear me? Or at least some people can hear me, maybe. All right, I got people who can hear. So I'll just go ahead and talk. Calling me a presenter is probably a gross exaggeration. I don't really have a presentation. I'm just going to talk about experiences that I've had with the mental health system within the CF, good and bad. So I'll just go ahead and jump right in then. Around 2017, I had I'm not going to go into specific details, but I had an personal event in my life that was sort of a trigger, I guess you'd call it, that sort of sent me spiraling. And it was starting to affect me professionally. And I ended up pulling myself off of a deployment, temporary deployment, a TD, and sought out on my own some assistance, I guess, in the mental health system. So initially, when I made contact with them, based on my, sorry, maybe I should introduce myself, but a little bit more with my amount of time and my experience, but they suspected it was PTSD. So I was screened for that, and I went through, I'll say exhaustive, to me, certainly, psychological evaluation. Turned out it was not PTSD. It was a depression. More, it was diagnosed with a depression, which is, from what I understand, all PTSD is depression, but not all depression is PTSD. So I was pretty well injured or ill, if you want to look at it in terms of the road to mental readiness spectrum, from moving from green into yellow, orange, and red. I was definitely in the orange. I'm maybe right on the border and being red or ill a lot, and it was determined that I probably had been for quite some time. But the treatment, I guess, or the therapy that I received from mental health was invaluable. Like literally, I would say life-saving. And without that, I don't care to speculate on what would have come next for me in that circumstance. So I wanna switch gears a little bit and talk about support from your chain of command and looking at mental health from a sort of middle management supervisor who've got subordinates who might be in distress. So the first time I think I probably should have engaged the mental health system was when I was coming back from a tour. I remustered from the Army in 2005, 2006. And there was no support that you would know about as a private in an infantry battalion, and not a whole lot offered, and a whole lot of sort of suck it up and soldier on, which we did for any sort of injury or illness, or at least I did. I don't want to speak for other people, but had I had a chain of command that at the time recognized that I was struggling with something or needed other supports, I probably wouldn't have ended up where I ended up years and years later, when I had to engage the mental health system, which was ultimately really for the first time. In that scenario, my chain of command was more than supportive and went above and beyond. I asked to take myself off of a deployment, just a 6-week thing, but was not going to work for my life at the time. And there was no question. They didn't even really want details. They could see that I was struggling with something, and they made it clear that they were going to support whatever I needed. Also, I was given, I don't want to say special treatment or anything, but I was offered a job that was basically a day job, because shift work was also going to be extremely difficult for me to manage with the personal side of my life. So all that to say is, had I had that support in the first place, way back in 2002 or whatever it was, I probably wouldn't have needed the help that I got more recently, really like 15 years later, before it really all sort of came crumbling down. So it's important for people who are in supervisory positions to be able to recognize that. And sometimes all it is just letting them know, reminding them, hey, go to mental health. Can't hurt. If worst case scenario, you get away from work for an hour. But having gone through it and having come through it successfully, I'm in a much better position to not push, but champion those supports, and almost like I'm coming from somewhere where I can appreciate what somebody might be going through and encourage them strongly to engage the mental health system if they need it. And within the forces, I would say most of us need it, if not all the time, at some point or another, and not enough people take advantage of it. So that's basically it. Sorry, I keep looking down. I had a couple of notes here, so I didn't miss anything. The only other thing I'll say about it is it's not magic beans. It's not a magic pill or anything. You're gonna have to do work. You're gonna go, and they're gonna give you stuff to do. Call it homework, call it whatever you want to call it, but they're gonna give you work to do that's not gonna be easy. Looking at yourself and looking at the choices maybe that you've made, or for whatever scenario it is. So while that therapist who I went to see really did probably save my life, you have to have a piece of it yourself. You have to do the work and recognize what your problem may or may not be, or your issue, and do the work they're trying to help you do to get through it. Because otherwise, it's if you don't do the work, it's going to fail. It's the same as physiotherapy or recovering from a surgery or anything else. So I hope that was enough. That's basically all I have. If people have questions, I'm happy to answer them.
Wonderful. Thank you so much, Sergeant Jordan. That was really, really enlightening. Emily, you can turn yours on too. I wasn't sure if you're gonna come back on here for me. Oh, we can't hear you.
I just want to say thank you very much for your transparency and also your bravery to speak out. Mental health is something that's incredibly important, and this is a very urgent topic. So by speaking out, you're being a positive light and an encouragement to others. So thank you again.
No problem. I'm gonna turn my mic off now, though.
For sure, yeah. If anybody does have any questions, you can feel free to put in the chat box. You can wait a little bit, or we can actually just go on to our next speaker, and then we'll kind of go see if there's any more questions that kind of come up. Again, if there's questions at the end, we'll have time at the end for all of our presenters for questions. And of course, if you have any questions after the fact that you weren't comfortable asking in the chat, you can. We'll put our emails in there so that you can contact us, and we can get to send them off to the presenters. Okay. Perfect. So, Sergeant Jordan, I'll just get you to turn off your camera, and I will invite Doug to turn on his camera and mic.
Can you hear me?
I can hear you. Can't see you yet. There we go. Perfect. All right. So I'm going to turn off my stuff again, and I'm going to hand it over to Doug.
Super. Thank you, everyone. Thanks, Sergeant Jordan, for putting yourself out there, so we would maybe we could get a little inspired by you and go seek some help if they're watching this and they might need a bit of help. So it's folks like you that speak up that really make it beneficial for everybody else to take advantage of the system that's there to support us. And that'll lead me into what I'm here for today. My name is, like they said, Doug Brown. I'm over at the Transition Center, and I'll give you, just in case some of you don't know, we're a small part of a big picture called the Transition Group. Transition Group's the strategic level in Ottawa, commanded by a Brigadier General. Then we come down one tier to a transition unit. So our unit headquarters is actually in Edmonton, led by a Lieutenant Colonel. And then here at the Transition Center, we have our team, the tactical level, if you would, of support for all members of the CAF now that the Transition Advisor, myself, for Cold Lake is in place. And I'll just go over some of the stuff that we can do for you. And so what does a Transition Center do? We support people. If you don't know where to go, how to go, who to go, when to go, why to go, stop in and see us, and we'll definitely be able to help you and direct you and support you, and at times maybe even walk you over to where you have to be in order to get the support that you require. There's a military chain of command. We are led by Lieutenant Matzner, Monica Matzner. She's our officer commanding. There's a platoon warrant officer, a sergeant. And on the services side, we have a services manager, Carl Jodry. I think they're both watching this today. And we have a services coordinator, Margaret Evans. Some of you may already know her. My role is a service transition advisor, and my role is kind of what they said in the bio there is simple but yet complex at times, because everybody's situation is different, and I come to the table with a bunch of resources to help you out. And what that could be a simple thing like sitting with you to ensure that you make an appointment with Veterans Affairs to do stuff like a transition interview, or if you're retiring at CRA, what does that mean? If you're ending a contract, what does that mean? I want to switch to the reserves, what does that mean? And then we just have those conversations, and we walk you through it and help and guide as required. Some of the service providers that we deal with are folks like Veterans Affairs Canada, the Military Family Resource Center, our unit Padres, the Legions, programs like the Soldier On program, the OSIS program, peer support programs that are there for you. The OSIS program in particular is a mental health, mental wellness program that provides peer support, and it's a very good resource to use. They do one-on-one sit downs, so when you think there's nobody out there that cares or wants to listen, au contraire, the OSIS program is there to help with that. We also work with places like the CISA community, helping them with that. Things that the services coordinators do is they help the ill and injured on navigating that complex system with return to duty stuff, designated assistant help should there be a tragedy, We work with the chain of command. We advise the chains of command on all issues, ill and injured or transition. And we work with you, the members in your families. So yeah, if you're ever in doubt and you don't know where to turn, please come on over and have a sit down with one of us. And you just might be surprised about how simple the support can be once you reach out. And that ends my 10-minute talk. I think I did it in 5, so that's awesome. Anyway, if there's any questions or points, let me know and I'll do my best to answer them.
Thank you so much for sharing. And also very good brevity. That's nice, 5 minutes and 10. And
Thank you for sure.
check the chat. So we have no questions as of right now, but if there's any, if you just want to add them to the chat, and then we can bring them up in the end.
That's right. So Alexa, I think that's how you say her name, Alexia. Anybody can come into the transition center, still serving or retired. You can bring your family in with you, a family member or a friend. Sometimes if you're sitting with Carl or Margaret, you're a little amped up anyway, depending on what brought you in there. So I often say, bring someone with you if you can, and that way that someone is the sober second thought, right? So when, you know, sometimes we go on what I like to say, like permanent send, where we're always talking about how to help with the situation, and you're listening, but you're not receiving it all. So you're listening and you're nodding your head, but really inside it's not really registering. You're just picking up on key points or small points of the larger conversation. So if you bring someone with you, that one person could be the sober second thought that asks those questions that, one, you might not be comfortable to ask, because let's be honest, our spouses are usually, or someone that cares about us is usually somebody that won't be afraid to ask that question that you may be afraid to ask. And that question may be the key to getting you the support that you require.
That's excellent advice. Thank you for sharing that.
Okay.
How has COVID changed the transition center? Do we need to make an appointment, connect by phone, or can we stop by and ask? Well, up until yesterday, you could just stop in. But with the rapid rising cases of COVID in our province, we've had to take some measures. So on the splash page, and maybe we can get PSP to put it on their Facebook page too. But I'm thinking as I'm talking. On the splash page, all of our email addresses are there. So all you have to do to get an appointment is literally send us an email and we'll answer it within minutes, unless it's after hours, of course. And we'll book an appointment with you right away. Does a TC ever reach out if somebody receives a tip about someone who needs help? You can always stop into the TC and say, listen, my buddy's not doing well. And then we can brainstorm about how's the best way to approach your buddy. Does that make sense? No problem, Steve. COVID puts a little trickle into how things work for us, but we are still there to support and we're still there to help. So if you need us, it literally takes 2 minutes to send an email to get your appointment booked, and then you're locked in, and come on in, we'll support. And of course, if you think it's an emergency, stop in. Like don't. So we're not crisis workers by any stretch of the imagination, but sometimes when life is spinning out of control and you don't know where to turn, please stop in. You will not be turned away. Yeah, Carl, the service manager says sometimes we get referrals from the chain of command as well as nurse case managers. That is a fact. There's lots of times where individuals or the chain of command have questions or queries, and they always reach out. But a lot of times it's for the ill and injured, and Carl or Margaret will get those calls, and they'll guide and advise the chain of command and help the nurse case managers accordingly. I think that might be it. Questions for now.
Yeah, no, that's great. Okay, thank you so much. And we will be moving on to our last speaker, actually. So if you don't mind, there we go. Perfect. Okay, so I'm going to introduce our last speaker here. It's Dr. Alan Okros. Dr. Okros served in the Canadian Armed Forces from 1971 to 2004 and was appointed Officer of the Order of Military Merit in December 1997. He holds a PhD in Industrial and Organizational Psychology. As a researcher on leadership, gender equality, and diversity, Dr. Okros has contributed to a range of Canadian and international projects to achieve equality objectives and enhance military operational effectiveness. Dr. Okros conducts research to support the NATO Committee on Gender Perspectives. As a policy entrepreneur, Dr. Okros advocates for the evolutions in military's understanding and approaches to diversity and inclusion within the CAF and internationally, involving the military in the United States, Australia, New Zealand, Bolivia, Singapore, and South Africa. He has presented subject matter expert testimony in the House of Commons standing committees and the U.S. 9th District Court case that struck down Don't Ask, Don't Tell, where he was cross-examined on the witness stand for 8 hours. He has provided policy options for more inclusive approaches regarding Indigenous peoples and those marginalized based on gendered identity or sexual orientation, including the requirements to address adverse aspects of military social construction and harmful use of social power. Dr. Okros, over to you.
Very much. So I'm speaking to you today from Toronto. So want to acknowledge that that's the traditional lands of the Mississaugas of the Credit, as well as Chippewa Wendat peoples. And Toronto is currently the home of significant number of First Nations, Inuit, and Métis people. I'd like to thank Emily, Lisa, and Alexia for the opportunity to speak with you. And I'll thank Joelle a little bit for the opportunity to learn a little bit more about turning 67 and the joys of men and prostates, something I'm working my way through. I wanted to pick up on some of the comments that were made earlier that Emily started with in terms of some of the statistics and some of the numbers. But to do so, I want to put it in context about the military. And I'll say we, I spent too much time in uniform and to not do it. There's things we value in the military. We value fitness, discipline, determination, perseverance, pushing through, getting the job done. Some of you have heard me talk previously about gender in the military. And one of the things we need to recognize is we all grow up learning how to act the right way. Boys have to learn how to be boys, girls how to be girls, which extends to, what real men are and what real men do. And I think it's particularly relevant talking about folks that are located in Alberta, a province that tends to really celebrate the pioneer spirit, the concept of I've built it myself, I'm not reliant on anybody else. Because what we're talking about is rugged individualism, and it's alive and well in Alberta. And I'm not even going to mention fighter pilots. And so what are some of the issues that come with the kind of notions of being real men about celebrating rugged individualism? Well, to extend on some of the stats that Emily used, in the Canadian context, men commit 80% of homicides, and they represent 70% of homicide victims. They're more at risk of being victims of violent crimes. They're 3 to 4 times more likely than women to die by suicide. As Emily pointed out, life expectancy, 6 years shorter. Boys are far more likely to be diagnosed with attention deficit disorder, 4 times higher for autism. In the CAF context, men are twice as likely to experience alcohol abuse. When it comes to career transitions, so it goes back to some of the things Doug was talking about, men are more likely to encounter depression on retirement. Military veterans are overrepresented in our homeless population. So we're talking about health and wellness. One of the things we need to recognize is all's not well here. So one of the things I want to point out was last year, the American Psychological Association, for the first time, put out guidelines for what they call toxic masculinity. And they point out traditional masculinity, things like stoicism, competitiveness, dominance, aggression, is on the whole harmful. Men get socialized in ways that are not good for health and healthy behaviors. Some of the research points out things like men with the strongest beliefs about masculinity are only half as likely as men with more moderate masculine beliefs to get preventative health care. So a good calf illustration, talk to the folks up at the clinic. The guys pretty well need to have white bones sticking out before they bother showing up on sick parade, right? I can tough it out, take a knee. We know from some of the stats in the military, men go to the MIR far less often than women, but they end up requiring more days of sick leave. So one of the things we tend to recognize with this is women tend to listen to their bodies. Men tend not to. They tend to suppress stuff. From the American Psychological Association data, men who conform to masculinist norms are more likely to consider it normal to engage in risky health behaviors, heavy drinking, using alcohol and tobacco, avoiding vegetables, especially broccoli, engaging in risky behaviors. One of the challenges in the military is men engaging in going for that rush, the adrenaline high. In 2018, the #1 cause of deaths in the US Marine Corps was motorcycle accidents. So we need to be thinking about how some of these pressures to behave in a very masculine way impact on people. It extends to self-care on psychological health. So a bit of what Bill was talking about. Men who were brought up with traditional notions of masculinity were more negative about seeking mental health services. They're often reluctant to admit vulnerability. And part of that goes into this are the myths that we create. We do these broadly in society about who men are and what they do, but we do it in the military as well. Some of you may have heard the CDS, General Vance has a nice little spiel that he does about the myths we create, that all our soldiers are 10 feet tall and invincible. Okay, we got the folks with the narratives. I can pull 6 Gs without a G suit. I can rush into a burning building without a mask. It's just a few fumes. We get into these ideas about what's expected of us, and there's a whole veneer of bravado, and we encourage it amongst each other. Somebody that gets hurt with the idea of just walk it off. Just take a knee. You can carry on. So part of what I want to talk about with this is we need to really get the message out to everybody that it's quite acceptable for men to reach out and take help. We don't have to keep ourselves constrained in these rigid norms of I can't show vulnerability, I can't look for help, I can't reach out to other people. I think it's really important, and now is a really good time for us to do this. So what can we do about it? Well, I thought of a couple of examples. Many, many years ago, when I was doing my sea time, a good friend of mine who was a Sea King pilot, and I will point out that rotary is the toughest flying anybody does, but that's a side point. He decided to give up smoking, which was a good thing to do. And if you talk to anybody that's had to give up smoking, one of the challenges that he had with that was, what do you do with your hands? And so he was looking for things to keep his hands busy. And he took up crocheting. Now, he's on board ship, surrounded by a whole bunch of sailors. They gave him a hard time about it, but he persevered, and he kept doing it. And what he noticed over time was, because he was doing it, it caused him to sit down, to calm down, to relax. And he found he was far less irritable. He slept better. He cut down on alcohol consumption. It changed a whole host of things because he found a way to relax. So there's a whole host of things. There's another person I heard talking about this, saying, keeping things bottled up inside is really hard on men. And sometimes you just need to talk about it. And one of the things that he talked about, he started into this, was he started talking to his dog when he took his dog out for the evening walk. Just getting it out and verbalizing it helped him and got him to a point where sometimes he could blow off the steam, but sometimes he'd start recognizing the warning signs of, maybe it's time for me to start talking to somebody about this sort of thing. So I encourage people to think about this in terms of, what can we do? How can we support each other? How do we create spaces where people are comfortable speaking out? And I really encourage leaders in particular to think about this. How do you set the tone that says this is fine? How do we confront these stigmas, particularly the stigmas around mental health? I got started working on mental health issues in the early 1990s. I worked very closely with General Romeo Dallaire and had personal conversations with him when he was grappling with his really severe PTSD. And, you know, this recognition that internal within the CAF, we've got to make it acceptable for people to speak up, to say that they need assistance. And leaders need to set the tone for that. There's too many CEOs that are still bottling it up. They don't want to show weakness. Again, remember years ago out on a naval exercise that went horribly wrong, and after everybody got to some degree of safety and no ships hit each other, the Commodore, the one-star that was in charge of at the time, came on the radio and started off with, okay, so I screwed up royally here, and then really set the conditions for people to be able to then, you know, contribute to, yeah, boss, this is what went wrong, and this is what we need to learn from it, and this is how we can recover from it. So what I'm trying to suggest with this is it's really important for leaders at all levels, set the tone, set the condition for individuals, listen to your body, talk to your buddies, reach out and get help. And particularly for men who are feeling it really constraining to have to always be projecting this machismo attitude, this approach, etc. One of the things that I really recommend, talk to some of the women around you. Because I pointed out before, women in uniform have all learned how to do that aggressive, you know, be in charge, persevere, you know, kick ass, take names. They've all learned how to do that in the military very well. But most of them have also learned how to maintain, you know, stay in touch with themselves, reach out for help when they need it, have support systems, etc. So one of the many places in the CAF where women can provide men with some really good examples that men can learn from. So I've also been shorter than what had been planned, but I think I will also stop here and open it up for questions, comments, follow-on observations, responses from others.
Thank you so much. We're just going to look at the chat to see if there was any questions. We actually had Dr. Okros speak in our DWAO group, and it was an absolute pleasure. You have some very positive feedback. Any questions from the chats?
Okros, this is Joelle Thorgrimson. Just wondering what your advice is.
Oh, it looks like everyone was just very happy to hear from you.
Can you hear me?
Yeah, I can.
Okay. Just wondering what you can do to make your workplace a safe place for people to be able to bring up concerns. Do you have any advice on that front?
Okay, well that's excellent. Thank you so much, Dr. Okros.
Emily, are you hearing the other speaker that's coming on here?
I am not. I'm just hearing you.
Dr. Thorgrimson does have a question, so she just came on the mic, so we'll just let her ask the question. I'm not sure why you're not hearing it there, Emily.
Wondering what advice you have to create safe workspaces so that people feel comfortable bringing up concerns.
So a couple of the comments, and I start again with this is really up to leadership. It's up to the senior people in the organization to set the tone, set the conditions. And so the first thing that I think that goes with this is when senior leaders are able, are able to admit, for example, I'm having a tough day, I'm having, when they can open up and show that they're not perfect and they're not, that they've got questions, they've got concerns, that's one. The second one is very much people paying more attention to particularly body language, to what's going on, creating those opportunities on occasion, having the side chat with somebody, can I do something? Can I help you? Is there something I can do for you? I think those things are important. Things like this activity are important. Making sure that professional development sessions and opportunities to bring knowledge into the workplace so people know where referral systems are, who to reach out to. And again, particularly if there's somebody in the unit that has been having difficulties and is struggling, is to to find the way to make sure that everybody else knows that their buddy is getting support. Now, the follow-on that I'll say with that is one of the real challenges we have in the military, and I'll say particularly with senior officers, is senior leaders also need to be very careful on confidentiality, and making sure that they're not disclosing information that the individual does not want disclosed. So making sure that if they're connected with somebody and if they want the larger team to know that the person's getting support, etc., one of the first things that goes with that is you have to talk with the individual and you actually have to get their permission to share the information. And I have found, I've done it myself, I have found most times that the individuals are quite comfortable with that, but I think they certainly appreciate it when chain of command recognizes that they've got ownership and control over what information gets disclosed beyond the confines of a private personal conversation.
Oh, we do have another question in the chat box here. Any advice for someone wanting to get into the mental health field of work?
So I'll start and suggest that might be a good roundtable sort of question. I think that maybe all of the presenters might be interested in responding to that one.
For sure. So what we'll do is anybody who is a presenter, if you want to, you can turn your cameras back on. There's only 3 cameras a lot of time, so I can turn mine off, so at least 3 people can come back on. And you can turn on your mics and give you kind of your input on that question.
So maybe I'll start with this one and just make the comment to say that in the field of mental health, there's a wide range of roles and responsibilities people can take on. Which can start from people that get involved in a counseling role to people that go into doing, education to take on to become, qualified as counselors, up into the social work domain, and then certainly into the medical domain, both physicians, psychiatrists, etc. So there's a wide range in there of how, where somebody can make a contribution in this field. And I think it's really up to each individual in terms of your education background, how much time and effort you want to invest in pursuing the kinds of qualifications that would open up the doors for you to make a contribution and be able to reach out and help others.
Can be like a first point of contact. So if that's something that you could get involved in as well.
Wonderful. Thank you for that input there. So I'll just wait for a couple more seconds here and see if anybody else has any other questions. If you don't have any questions, you can also just feel free to put in the chat box that you're good to go. I just don't want to cut anybody off who's in the middle of typing this massive question or anything. I've done that before and I don't like doing that, so. No, mic isn't working again. Okay.
Can you hear me now?
Yes, we can hear you now. Oh, okay, here we go. We have a question. So with the Me Too movement, Black Lives Matter and other issues, white men are often seen as the perpetrators. What advice do you have for white men, the majority of CAF members, to be proud? Okay, so I'm going to pass that over to our speakers, and if anybody has kind of anything they want to add to that, I'm going to turn off my camera again.
Yeah, I'll step into that one and answer it. I fully agree. The vast majority of men want to live good lives. They want to treat people around them with respect. Again, we go to some of the principles of the Defense Ethics Program, some of the professional concepts of treating all people with respect. I think that is important. In there, I think, however, it is important, and it's a comment I made the previous time I spoke, I think it is important, however, to be able to recognize that society does give privilege to certain people based on both gender and based on ethnicity. And whether somebody believes they have benefited from it or not, I think it's important for people to recognize that in some cases, they have been afforded privileges that others didn't have. And so part of the big thing that I would go from there is, if somebody's in a position where they've accomplished things, where they have positions of responsibility, where they have positions of power, the best thing you can do is pay it forward. Reach out, find others that you can work with, that you can assist, particularly men who are allies of women and the Women, Peace, Security agenda, white men who become allies of the Black Lives Movement, to move things forward. I think those are the contributions that men can make, still feeling proud of who they are and what they've accomplished, but recognizing that more work is needed in order to achieve the kind of equality where everybody gets the same benefits that they may have had as they were growing up and developing in their careers.
Thank you for that response. Okay, so the next question, it looks like it's for me. So it is recorded. So information on where we can rewatch it later. So generally speaking, anything that is a health promotion type webinar, this is hosted partially by Health Promotion, it is uploaded to the CFMWS YouTube channel. So I'm not 100% sure on the turnaround of that, just because I don't upload it. A team in National does. However, what I can do is I can send an email out to the registrants, so anybody who's came today, to let you know when it has been uploaded, so that you guys can go and see it at your own leisure, as well as to share it with other people who may not have had an opportunity to come today. Is there any other final questions for either myself, for the DWAO, for HP, or for any of our presenters? Okay, and Alexia's just kind of made a comment here saying, recommending formally mentoring those who don't look like you as well, since typically people mentor those that remind them of themselves. And that's a very good point as well. Typically we do kind of gravitate toward those that are kind of images of ourselves. So kind of reaching out to those people that aren't is really important. And she's also thanking all the speakers. Okay, awesome. So Emily, is your mic and everything working now? Technology has really not been our friend, and I truly do actually apologize for all of the technical issues that we've had tonight. Generally speaking, we do not have this many issues on this platform. Just not a lot of incompatibility, unfortunately, tonight. So I do apologize for that. And again, hopefully everyone can kind of see that recording and hear the things that they weren't able to hear tonight. So I do apologize. I can hear you, I think, Emily. I think you're good.
Hey, sorry, Lisa, I can't hear anything you're saying, but can you hear me? Yes? Okay, excellent. I just had one final point that I was going to say. Thank you so much to all the guest speakers. This was incredible hearing the various aspects of men's health issues. Thinking back on the statistics that we had mentioned earlier on suicide and cancer rates, we can see how urgent of these issues are. So like the Movember mission explains, men's health is in crisis. So opening up the conversation tonight has been a great start in breaking the barriers and the stigmas surrounding that. So thank you again to our guest speakers, and happy International Men's Day tomorrow.
All right, thank you for that. And thank you again. I want to reiterate, thank you so much for all the speakers, and thank you for everybody who took the time to come in tonight. I do appreciate it. I know we kind of took you away from either your supper time, or if you're out east or even in a different country right now, we may have taken you away from your evening activities. So I really appreciate you taking the time to listen to our speakers tonight, and for our speakers for taking the time out of their evening. Again, if you have any questions at all, what I'm going to just do right now is I'm just going to put my email in here. It's my Forces email. So if you happen to think of any other questions at any time for any of the speakers, or for health promotion, for DWAO, or about Movember International Men's Day, please send me an email and I will send it to whoever needs to have that, so that we can get an answer for you. We're always open and approachable for any questions from any member or defense team individual. Again, thank you for everyone. Have a great rest of your evening. Hopefully you're able to enjoy it, or if anybody's from East Coast or further, have a good sleep. And Alan has Dr. Okros has also put up there his email there too. So if anybody needs to talk to him directly, he's happy to follow up. All right, so I'm going to shut this down. Have a great night, everybody. Bye.